The period a fetus grows inside a uterus is known as pregnancy. When sperm enters the fallopian tube through the vagina and fertilizes an egg, conception takes place. A pregnancy starts when the fertilized egg implants into the uterus following fertilization. Teenage pregnancy is when a woman under 20 gets pregnant. It usually refers to teens between the ages of 15 and 19, but it also can include girls as young as 10. It's called teen pregnancy or adolescent pregnancy too. Why is it a problem? Teenage pregnancy risks a lot of things, such as lack of prenatal care. Pregnant teens are at risk of not getting the right prenatal care, especially if they don't have support from their parents. Prenatal care is critical, especially in the first months of pregnancy. Prenatal care looks for medical problems in both mother and baby, monitors the baby's growth, and deals quickly with the complications that arise. High blood pressure. Pregnant teens have a higher risk of getting high blood pressure, called pregnancy-induced hypertension. They also have a higher risk of preeclampsia. This is a dangerous medical condition that combines high blood pressure with excess protein in the urine, swelling of a mother's hands and face, and organ damage. These medical risks affect the pregnant teen who may need to take medications to control symptoms, but they can also disrupt the unborn baby's growth, and they can lead to further pregnancy complications such as premature birth. Premature birth. A full-term pregnancy lasts about 40 weeks. A baby that delivers before 37 weeks is a premature baby. In some cases, premature labor that begins too early in pregnancy can be stopped by medication. Other times, the baby has to be delivered early for the health of the mother or infant. The earlier a baby is born, the more risk there is of respiratory, digestive, vision, cognitive, and other problems. Low birth weight baby. Teens are at higher risk of having low birth weight babies. Premature babies are more likely to weigh less than they should. In this part, that's because they had less time in the womb to grow. A low birth weight baby weighs only 3.3 to 5.5 pounds.
According to World Population Fund 2019, on average, about 5,000 girls who entered into sexual intercourse at a minor age are recorded, 1.3 thousand girls of which have an abortion. In 2019, about 12 million teenage girls between the ages of 15 and 19 became mothers. Girls who become pregnant before reaching maturity may face long-term health concerns, social disgrace, and unfavorable financial consequences. In addition, they are more vulnerable to health hazards than adult women between the ages of 20 and 24, which include low birth weight babies, serious newborn problems, and complications from labor that lead to maternal mortality. The choice of the method of abortion depends on the stage of the pregnancy and other patient factors. In general, the further along the pregnancy, the more complicated and difficult the abortion method. An ultrasound exam may be needed to check the stage of pregnancy before an abortion can be done. A woman in very early pregnancy may have the option of an abortion that uses medicine instead of a surgical abortion. She will need to see the healthcare provider at least one more time to make sure the medication abortion is complete. It is very important that she take the medicine exactly as the healthcare provider tells her to take it. The second method is suction curettage. The vagina is cleaned with a liquid soap. A shot to numb the cervix is given. Then the cervix is dilated. A tube attached to a suction machine is put into the uterus. The uterus is then emptied by suction. Next, a tool called curette is used to scrape the wall of the uterus. This removes any products of pregnancy that remain in the uterus. Dilation and evacuation is the most common method used after 12 weeks of pregnancy. The vagina is cleaned with a liquid soap. The cervix is usually prepared by putting natural sponges called laminaria into the opening of the cervix. They soak up moisture and swell. This causes the stretching and opening of the cervix. When the cervix has been opened, tubes and suction tubes are put into the uterus to remove the products of pregnancy. The last but not least method is hysterectomy. In rare cases, Where the induction method fails or cannot be used, a surgical method called hysterotomy must be used. Hysterotomy means to cut open the uterus. It is like a cesarean delivery and has the same risks.
Abortion pill is the most common name for using two different medicines to end a pregnancy, mifepristone and misoprostol. You can also use misoprostol alone to have an abortion. First, you take a pill called mifepristone. Pregnancy needs a hormone called progesterone to grow normally. Mifepristone blocks your body's own progesterone, stopping the pregnancy from growing. Then, you take the second medicine, misoprostol, either right away or up to 48 hours later. This medicine causes cramping and bleeding to empty your uterus. It's kind of like having a really heavy cramping period, and the process is very similar to an early miscarriage. If you don't have any bleeding within 24 hours after taking misoprostol, call your nurse or doctor. Your doctor or nurse may give you both medicines at the health center. In some states, you can do a virtual visit and have the pills mailed to you or pick them up at a local pharmacy. Some states have laws that say you must come to the health center for a separate visit before you get the abortion pills. Your doctor or nurse will give you detailed directions about where, when, and how to take the medicines, and they'll talk you about medicines to manage side effects like cramp, pain, and nausea. The abortion pill usually works, but if it doesn't, you can take more medicine or have an in-clinic abortion. Side effects: hemorrhaging. The abortion pill will cause some bleeding and cramping as it terminates the pregnancy and passes the tissue from the uterus. In addition to this normal bleeding, hemorrhaging and excessive bleeding may occur. While hemorrhaging related to the abortion pill is relatively rare, occurring in roughly 1% of abortion pill patients, the rate of death as a result of this complication is significant. Pelvic inflammatory disease. Abortion may lead to an increased risk of pelvic inflammatory disease, PID, while infected with chlamydia, a sexually transmitted infection. Mental health complications. Many women experience new or triggered mental health issues following their abortions, like anxiety, depression, or trauma-related symptoms. Increased fertility. Infections caused by the abortion pill can lead to the uterine scarring, which can cause future infertility and ectopic pregnancies.